My name is Joseph Mwangi Kamau from Nairobi, Kenya. I am 56 years old, and sometimes back in August, I started experiencing challenges with my health, lack of breath, getting tired when I do small calls, and also a lack of sleep. I was also having swollen legs and a bloated stomach. And when I went to seek medical advice, and the cardiologist advised me that I have a heart valve problem, I sought for opinions, and I got a recommendation that the best place I can get the treatment of the valve replacement is in India, Apollo Hospital in Delhi.
So he was referred to us for aortic valve replacement from Kenya. When we evaluated him, then we found that he had a very past history of tuberculosis, which has destroyed his right lung almost completely. And many structures of the heart had been pulled by the destroyed lung into the right side, which is mainly the aorta and the right chamber of the heart. And review echo here showed that he had not only a severe narrowing of the aortic valve, which needs replacement, but his left mitral valve was also leaking very severely.
And that is how I found my way to Delhi. And when I came here, I got a very good reception by Dr. Mukesh Goel, and the evaluations were done, and together with Dr. Nayak.
So now he required 2 valve replacement, and we did a CT angiogram to gather other information, because by echo we were not fully able to visualize all the structures of the heart because of the abnormal positioning of the heart caused by destroyed right lung because of tuberculosis. Then we found that he has an abnormal connection between the bronchial artery and the pulmonary artery, which we got a embolization closure by Dr. Rastogi, who is an interventional radiologist. Then during evaluation, we also noticed that he is having very low oxygen saturation. His oxygen saturation without any oxygen supplement, it drops to 80%, while the normal saturation is around 97-98%. And her PFT was also very bad. We consulted Respiratory Medicine specialist Dr. Akansha Chawla. So we reached to the conclusion that he is a very high risk for open heart surgical procedure to replace the 2 valves. Then I had an idea. We consulted Dr. Gautam Nayak, who's as a structural heart disease specialist and interventionist. And we thought that let's tackle the aortic valve with a TAVI procedure.
He had a remote history of pulmonary tuberculosis causing significant sequelae and damage to his right lung. Because of this, open heart surgery was deemed very risky, and hence we embarked on a transcatheter procedure on him. An Edwards Ultra Resilia 29mm transcatheter heart valve was implanted. Immediately post-procedure, the valve gradient significantly came down on the echocardiogram. He was discharged in a couple of days. His oxygen saturations at rest significantly improved from the early 80s to the late 90s.
And from that time, I feel much better. And I thank Dr. Gautam Nayak for his kind heart, and also for ensuring that every now and then he is monitoring my progress together with Dr. Mukesh. They have been very kind to me and good doctors.
He has significantly shown improvement in his symptoms. He is doing light exercise and feels well in himself. His mitral regurgitation on the echo has also reduced by 1 degree, and his heart pumping is now back to normal.
And my experience here at Apollo Hospital has been very good, and now I feel much better. I have regained my health. I can breathe well, no fatigue, and I can do exercises here and there.